This instructional video is to show how reflexology treatment is given using the technique taught by the Bailey School of Reflexology. I'm Nicola Hall, the Director of the Bailey School of Reflexology, and I shall be giving a full reflexology treatment to my patient, Audrey Wall. Firstly, it's important that the patient is sitting in a comfortable position. A recliner chair is ideal as a reflexology treatment chair. The patient's back and neck are well supported. The patient's face is upwards so that they can talk to the practitioner without having to bend forward. The legs are raised and there is a slight bend to the knee so that from knee to ankle is totally supported. This will mean that the feet are in the most relaxed position possible, and also the feet are at a height which is comfortable for the practitioner to apply the massage. Talcum powder is used on the feet when giving a reflexology treatment. This allows a smooth area to be worked over. If the feet are a little bit moist, it will absorb some of the moisture. If the feet are very dry, then it will just give a smooth surface over the dryness. As the talc is applied to the foot, this will allow the patient to get used to the touch of the practitioner. And sometimes it is quite strange for people to have their feet touched. Massage is applied mainly using the thumb. The thumb is held bent and the side and tip of the thumb is used for applying pressure to each reflex point. The pressure is applied to the point, it's held on that point for a moment, and then the pressure is released. But the thumb is kept bent the whole time. That same movement is repeated then on the next reflex point, just a very short distance along from where you have worked. In different parts of the foot, different sensations will be felt by the patient. In some areas, when pressure is applied to a reflex point, the patient will just be aware of pressure but no discomfort. In other areas, when pressure is applied, it may feel rather uncomfortable, either a slightly bruised feeling, or it may even feel as if a nail is being stuck into the foot. These different degrees of tenderness will indicate to the practitioner how out of balance the corresponding part of the body is. So, for the reflexology treatment, massage is given to the right foot first, and starting with the pituitary reflex in the centre of the big toe. Use the right thumb to apply pressure to the centre of the big toe. Use the left hand to just support the top of the toe. Having worked the very centre of the big toe, then work an area all around the very centre point and work area around that centre pituitary point. And that will all relate to parts of the brain. Next, the neck reflex. Use the right hand starting on the inner border of the foot and work just along below where the toe joins the foot. Then up the side of the big toe, next to the second toe, for the side of the head. Change hands at the top of the foot and use the left hand to work over the top of the big toe, and this will relate to the reflex to the top of the head. And then continue on down the inner side of the foot following the bony arch of the foot right down to just in front of the heel, and this is the spine reflex. So use the left hand, and movement should be in a forward direction. That means the direction in which the thumb is pointing. So that is why it's important to use the left hand to go down the spine reflex on the right foot. Make sure as you work down the spine reflex that you don't go too quickly and don't jump along the reflex, leaving out important parts. Having got to the coccyx reflex, just in front of the back of the heel, change hands and come back up the spine reflex, following a slightly straighter line up the side of the foot. You then work from the base of the spine upwards. You may need to just rest the fingers slightly underneath the back of the heel to start with. Then when you get to about waist level, bring the fingers round to the top of the foot and continue working up the foot. The left hand, which isn't giving the massage, will be just supporting the foot. Having completed the spine reflex, then do the reflex to the face found on the front of the big toe. And you can use finger pressure for that reflex. So all the area below the nail. Next, the small toes, which relate to the sinuses. So each toe must be worked on in turn. Support the toe at the tip using the left hand, and with the right hand massage from the base of the toe up to the tip. Then work up the sides of the toes, so both the inner border and the outer border of the toe. And then the same sequence for each little toe in turn. In some instances, if the toes are very tight together, then it may be easier to work in a backward direction up the sides of the toes. And again, work from base up to the tip of the toe. Then on to the fourth toe. One movement up the back and up each side should be sufficient, but if you were working on very broad toes, then you might need to work the area with two movements rather than just the one. Having worked the backs and sides of the toes, you then need to work the fronts of the toes, which relate to the reflexes to the teeth. And again, finger pressure is probably easier, working from the base up to the tip of the toe. After the reflexes found in the small toes, then the eye reflex. So that is found beneath the second and third toes, just below where those toes join the foot. So pull the toes back slightly and work with the right hand, working just below where those toes join the foot. Then the eustachian tube reflex, which you'll find just below the web between the third and fourth toes. And then the reflex to the ear, which you will find just beneath the fourth and fifth toes. Next, the shoulder reflex. That reflex is going to be found on the sole of the foot, just beneath the little toe, and also on the side and on the top of the foot, so like a little cap around the small toe. So work the area on the sole of the foot first, And also work the shoulder reflex on the top of the foot and down the side of the foot. And as you work down the foot, you will be covering the reflex for the arm, and then actually on the bony projection, about halfway down the outer border of the foot, that relates to the elbow reflex. Then come back up, that same area, before moving across to the other side of the foot again. Next, the thyroid gland reflex, and that is found all around the ball of the big toe. So you start the spine side of the foot, working with the right hand tight in beneath the ball of the big toe, and then up the side of the ball of the big toe to just below the web between first and second toe. As you work that area, you will overlap the parathyroid reflexes. And the lower parathyroid reflex will be found just as you turn the corner to come up the side of the ball of the big toe. The upper parathyroid reflex will be found just below the web between first and second toe. Then, using that same L-shaped pattern, cover in the whole area over the ball of the big toe, as that will all still relate to the thyroid gland. Next, the lung reflex, which you will find beneath the second, third, fourth and fifth toes in the area covering the rest of the ball of the foot. So start in zone 2, just below the second toe, and work straight across all the zones using the right thumb. And then when you get to zone 5, change hands and come back with the left thumb across all of the zones again. And then just keep working backwards and forwards, changing hands as you get to the side of the foot until you've worked all the reflexes relating to the lung. Sometimes it can be quite a tough area of the foot over the ball of the foot, so you may need to apply slightly firmer pressure. Then the solar plexus reflex, which you will find in zones 2 and 3, just below diaphragm level. And diaphragm level is where you get the transverse arch to the foot. In some people, not so much in this foot, but there is sometimes quite a marked coloration between the reddy pinky area of the ball of the foot and then the very pale skin of the rest of the foot. Solar plexus then in zones 2, 3, press in on that point with the thumb. And then the liver area. So the liver reflex is in the area between diaphragm and waist level, in zones 5, 4, 3 and a little bit of zone 2 and 1 in the upper part of the area. Start in zone 5, just below diaphragm level, so use the left hand to work across all the zones. Then when you get to the inner border of the foot, change hands, come back following a slightly lower line across the foot. Area, it's really only necessary to work zones 5, 4 and 3, since the liver just tapers off into those upper area of zone 1 and 2. As you work the liver area, you will also overlap the reflex to the gallbladder, and that you will find in zone 3, just above waist level. Just that one precise point. The rest of the area between diaphragm and waist level will relate to the stomach and to the pancreas. So the stomach will be found in zone 1 and the pancreas reflex in zones 1 and 2, but the lower half of the area between diaphragm and waist level. So you can just work across these areas starting on the side of the foot and working across zones 1 and 2. start the small intestine reflex in zone 1, just below waist level. Work across using the right hand, across zones 1, 2, 3 and 4. Then change hands, come back using the left hand, but following a slightly lower line in that region, and then just continue zigzagging back across the foot so that you cover all the area for the small intestine. So that will be below waist level and above the pad of the heel. Finish up on the outer border of the foot so that you can